finally I come to some conclusions about why is it, in fact, so difficult to fight antimicrobial resistance as a public health threat. And this all goes back to a bit of a philosophical approach that this gentleman here, his name is Jared Hardin, in 1968, formulated in a famous Science article, which he called the tragedy of the commons. What he alludes to is actually the fact that 17th century England had common pastures where villagers put their cattle without fence on a pasture that belonged to the whole of the village. The question for every herdsman, however, was how many of the cattle should I put on the pasture? And game theory, or egoism you can also call that, dictates that when you really think about it, and farmers are clever people, of course, is if I put one cow and the gain goes to me, the grass that it eats is divided, of course, and shared as a loss by all the villagers. So why putting only one cow? Actually, the idea is to increase as many cows as possible on the common pasture in order to increase my gain, because the loss, the trade-off, will be shared by the community. And certainly, this will lead to overgrazing, the decay of the common pasture, and to a tragedy, as he calls it, because it is remorseless in its working. It's a bit like something that you cannot escape. And many of our current problems, not only antibiotic resistance, but also problems of global dimensions like climate change, environmental degradation, overfishing of resources, and so on, and maybe even the credit crunch that we currently see and face, are all tragedy of the commons. And how do we control it? Well, we cannot find, and what usually unites these problems is that there is no technical solution to tragedies of the commons. The solutions must be morally achieved. And that's what is typical for all these tragedies that we see increasingly in our complex interacting world. I will now show you 4 tragedies applying to antimicrobial resistance, and I will go through them. The first is in antimicrobial consumption, and that's very clear. The idea is that prescription habits, appropriate or inappropriate, both will curtail the long-term effectiveness of antibiotics. Doctors and patients make rational choices. Doctors are paid to make patients good and better, and they are not paid to care for the common good of the whole of the population. This is what doctors are for. You expect from your doctor to look after you. And you want to go to work and be fit as soon as possible if you have a flu and take an antibiotic, and that's wrong, because the flu is caused by virus and antibiotics wouldn't work. So is it a rational choice? Maybe it's not a rational choice, but many consumers demand from their doctors antibiotics. So are we doing enough? Clearly we are not doing enough. So what can be a solution to the first tragedy of the commons? I give you some potential solutions. We are discussing in the last couple of days at WHO a whole bundle of solutions, but I will give you only a couple of them here for time reasons. We have to raise public awareness in order to change consumer attitudes towards antimicrobial abstinence, of course, leaving milder self-limiting infections untreated. This can be difficult, of course. When do you know if an old lady comes with an uncomplicated urinary tract infection, and when do you know that this is mild and will be self-limiting? In an old lady, if she may have a diabetes, this can also be the first sign of a urosepsis and could lead to very serious complications. So here you need, of course, good clinical judgment. What we could, of course, think about is share the costs borne by the use of antimicrobials with the whole of the society. And this is quite accepted practice. If you have a scarce resource like parking space, everybody pays a couple of euros to put in a parking meter and for the duration that he parks a car in central town, metropolitan areas. So that would be an antibiotic levy that we put on top and provide some funding for developing new antibiotics. And then another way, of course, would be, and that is done in many countries, making prescribers accountable for overuse. Identifying among the doctors that use too much antibiotics and then ask them, Why do you do that? And maybe they have a good reason for that because they have a special client, a group of clients, but maybe they sometimes just overdo it. On last Tuesday was the European Antibiotic Awareness Day. This was the first of its kind. It was in the whole of Europe, supported by the European Parliament and by the local ministries of health. And one of the main messages was, if you have a flu or a cold, take care, don't take antibiotics.